We've all heard the phrase, a broken heart, right? It sounds like something out of a poem or a really sad song. But what if it's not just a feeling? What if it's a real physical event that can actually land you in the emergency room? Yeah, let's get into this.
So let's just cut to the chase. Can you actually die of a broken heart? Well, the answer, and this might sound unbelievable, is yes. You can, and it's all because of this fascinating and very serious medical condition that literally connects our deepest emotions directly to our most vital organ.
Okay, so the official name for this is Takotsubo cardiomyopathy, or TCM for short. It's also called stress cardiomyopathy, but its most common nickname is, you probably guessed it, broken heart syndrome.
So what exactly is it? Well, TCM is this sudden, temporary weakening of your heart muscle. It happens when an incredibly intense stressor, I'm talking about the death of a loved one, a serious accident, even a major surgery, floods your body with stress hormones. It's so much that it basically stuns the heart's main pumping chamber, the left ventricle.
Now, here's the crazy part. The symptoms, that sudden chest pain, shortness of breath, they feel exactly like a heart attack. It's terrifying, but the cause is completely different. In a normal heart attack, doctors find blocked arteries. You could say it's basically a plumbing problem. But with broken heart syndrome, the arteries are clear. This isn't a blockage, it's more like an electrical storm, triggered by that overwhelming surge of stress.
And this condition is surprisingly specific about who it affects. Get this, a staggering 89% of reported cases are in women, especially after menopause. One of the leading theories here is that estrogen might give the heart some kind of protection from stress hormones. So, when those estrogen levels decline, vulnerability seems to shoot up. So, how is any of this even possible? How does a feeling physically damage your heart? Well, it all comes down to this direct physical link between our minds and our hearts. Scientists even have a name for it, the heart-brain axis. It's like a superhighway.
Okay, so let's walk through how an emotion actually causes a cardiac event. First, you have that intense stressor. The emotional processing centers in your brain, like the amygdala, just go into complete overdrive. This triggers a massive, and I mean massive, flood of stress hormones called catecholamines. That hormonal surge literally stuns the heart muscle, making it weak and even changing its shape. It's a perfect example of how a feeling becomes a physical reality.
And this isn't just a fringe idea. Medical reviews totally back this up. This quote here really drives it home. TCM isn't just a heart problem, it's a neurocardiac event. To really understand it, you need cardiologists, neurologists, and psychiatrists all working together, treating the mind and the body as one single interconnected system.
For a long time, doctors thought this was a relatively benign condition. The heart muscle damage was often temporary, so it seemed okay. But we now know that's just not true. Recent research is showing that the long-term health risks for a survivor are pretty much the same as those for someone who's had a classic heart attack. It's serious.
So, knowing that extreme stress is the trigger, it kind of raises an important question, doesn't it? What about the people who are exposed to this insane level of stress not just once, but as part of their everyday job?
And the answer, of course, is our doctors, our nurses, and all the other healthcare professionals out there. They are living on the emotional front lines, day in and day out.
There's this anthology written by healthcare workers that just captures their experience perfectly. It reveals, and I'm quoting here, the emotional core of medicine, tender, raw, and deeply human.
Think about what it means to live on that emotional front line. It's constant exposure to grief. It's vicarious trauma, where you're just absorbing the pain of your patients. It's burnout, something that affects up to half of all physicians in high-stakes fields. And then there's that profound, gut-wrenching sense of failure when a patient is lost. These are the exact kinds of intense stressors that can trigger a broken heart.
Okay, so what's the path forward? If our minds can actually harm our hearts, can they also help heal them? Let's take a look at some of the really hopeful new approaches for both patients who've suffered from this and the healers who are at risk of it.
So the key insight here, the big idea, is that this connection is a two-way street. We can use it not just to understand the damage, but to actively promote healing and build up our resilience.
And we actually have the data to prove this works. A really groundbreaking British Heart Foundation study compared different treatments for these patients. After just 12 weeks, the people who got cognitive therapy saw a 15% improvement in their fitness. An exercise program boosted it by 18%, and the standard care group, almost no change at all.
This is concrete proof that when you target both the mind and the body, you get real physical recovery.
Now, for the healers themselves, a really similar principle applies. It turns out one of the most powerful tools for building resilience against that constant stress is structured peer support.
And if you want to see the impact of that, just look at this pilot training program. It taught physician residents how to recognize and support each other through vicarious trauma. The result? An incredible 85% of them reported an increased awareness of this occupational hazard. It just goes to show that creating a culture of openness and support can be a powerful preventative measure.
So in the end, broken heart syndrome isn't just some medical curiosity. It's a profound lesson, right? It forces us to see this undeniable link between our emotional selves and our physical selves. And it really leaves us with a fascinating question. As we keep mapping this incredible heart-brain highway, how is it going to transform our entire approach to medicine, to wellness, and to what it truly means to be healthy?